to Dr. Anil Kumar sir, Director NOTO, for his valuable time for this ISOT webinar on financial support from NOTO to strengthen deceased donor organ transplant program in India. We are aware about leadership of Dr. Anil Kumar sir in expanding access to organ transplantation, blood transfusion services, Transplant Human Organ Act, and One Nation, One Allocation policy. At present, India is number 3 in the world for absolute number of organ transplantation, only behind USA and China. 85% transplants are from living donation, 15% transplants are from deceased donation. Deceased donation is more active in South and West India, and due to continuous efforts from NOTO and Dr. Anil Kumar sir, deceased donation has started in northeastern states like Manipur and Assam in the last year. Dr. Anil Kumar sir and NOTO family and team are doing best possible efforts to increase deceased donor organ transplantation in India. So now we will start this session and we will take question and answer at the end.
Today, I will be talking about the financial support from NOTO to strengthen deceased donor organ transplant program in India. I am thankful to Indian Society of Organ Transplant, which is running this EduConnect program, through which it is a very important initiative of the Indian Society of Organ Transplant, by which they can reach to a large number of trainees who can be benefited, and they are disseminating information through this platform. That is really commendable. So at the outset, I would like to congratulate ISOT regarding this initiative. So now I'm beginning my presentation on the financial support which is available from the government side for the deceased donor organ transplant. Next slide. So as we all know, there is a huge requirement of organ transplant in our country. This is the estimated need of organ transplant in the country. In respect of kidney, we require around 1.7 lakh to 2 lakh kidney transplants, new kidney transplants every year. And this is the number that we conducted last year, 11,705. Similarly, for liver transplant, we require 40 to 50,000 liver transplants every year. And we conducted last year 3,920. Heart estimated requirement is 50,000. We conducted 243, lungs 144, pancreas 26, small bowel 3. So total transplant that we conducted last year 16,041. We are fortunate that we have the support of our Honorable Prime Minister in this campaign that we run to promote organ donation, where Honorable Prime Minister has spoken 4 times since 2015, and where he has emphasized that one organ donor can save up to 8 lives by the act of noble act of organ donation. Next slide. This is where we stand in the world. This is the graph which shows 10 best countries in the world in terms of number of the transplants which are done. So India is at 3rd highest position in the world in the total number of transplants done in the world. But if we compare our deceased donor organ transplant proportion, which is indicated by the green bar, the cadaver transplant, where the transplant is coming from the deceased donor. So our proportion if you see the size, the height of the green bar is very low. So our proportion of the deceased donor organ transplant out of the total transplants is very low. So as compared to other countries where the green bar height is very high, proportionately very high in compared to the living donor transplants. Next, please. The main problem that we have in the country that our organ donation rate is very low. The number of the donors per million population in a year, if we compare with other countries, we are at around 68th position out of the 94 countries which gave the data to the GODT, that is a global observatory on donation and transplantation. So if we have 1,400 million population, so 941 donors last year, it comes to 0.67. This has marginally improved this year. It is now 0.75 around. So we have little improved as compared to last year, but still it is very low. As you can see, organ donation rate in case of Spain is 47, in USA it is 44.5. So donation rate is very low in our country. That is the major issue that we have right now before us. Next, please. This is the data since 2013 until 2023. This is the 2023 is the tentative number, as few states have yet not given the data for the December month. So 2-3 states are pending. So, but still, if we look at the graph, we have been consistently improving over the years. And this year, our total number is 16,473 till now, and 1,048 donors. So we have crossed that figure of 1,000 donors in a year. So this time the number is till now has been estimated, the donors is 1,048, and total transplants which have come from this donor is 2845. Sandeep, is it 2845? 2,845 transplants till now have been recorded from the deceased donor organ. Next, please. This is the situation all over the country. The red areas are the areas where there is no deceased donor organ transplant activity, no activities there in these states. So like if you look at the northeast, all the northeast except Manipur and Assam, there is no deceased donation activity. Then we have Jammu Kashmir, Ladakh, Uttarakhand, Jharkhand, and Union Territories of Andaman, Nicobar, Lakshadweep, and Daman, Dadar, Nagar Haveli. So, but as I told you that our deceased donor organ transplant, our donation rate is very low, but there are states where the donation rate is higher. Like in case of Telangana, in 2023, they had 200 donations. And if we calculate their donation rate, it comes to 5.41 per million population. So major part of the deceased donor organ transplant activity is happening in the dark green area, which is in the western and the southern part of the country. In the light green areas that you see, that is the area where the activity has been initiated. But the creamish area are the rather more challenging, where the activity got initiated, but it is not improving further. So it has got little stagnation in UP, in Madhya Pradesh, in Rajasthan. So in these states, the activities which we expect to rise further, it is not improving. So that is also a cause of concern. Next, please. So another issue that we have very limited number of facilities in the government sector. So this is the organ-wise transplant centers which are linked with the NOTO registry. We have 643 organ transplant center, out of which if we compare organ-wise, you can see in the kidney we have 500 in the private out of 571 and only 71 in the government. So similarly is the situation with other organs transplant facilities also. In the non-transplant organ retrieval centers also, we have around, proportionately, proportionately the facilities, number of facilities in the government sector is also very low in case of NTORCs also. Next, please. The main challenges that we have before us at the hospital level are the main challenges besides the high burden of disease which cause organ failure and lack of adequate dialysis facilities. We have less number of brainstem death identification and certification, which is there, and there are gaps in reporting the data. We are not getting the complete data, particularly living donor transplant, deceased donor transplant, outcome data in our registry. So that is a gap that we have. Our deceased donor maintenance and critical care facilities of the standard, basically they are also not very well available in many hospitals. As I told you that infrastructure availability for transplant in government institution is very limited. Another issue that we have from the hospital side that all the patients who require transplants, they are not being registered in the registry. That is that they should be registered. Pick and choose should not be there. Then we need to improve the awareness and improve the availability of the transplant coordinators. Then there are other issues, costing issues, transportation of the organs, because sometimes our government patients are not able to afford particularly the transportation cost. We need to protect our living donors also. So these are some of the challenges that we are facing. Next. This is the framework under which we work as mandated by the Transplant Act. It is a network with a national networking organization, that is NOTO, National Organ and Tissue Transplant Organization, at the apex level under the Ministry of Health. And then we have five regional organizations which are located in the southern region, eastern region, northeast, north, and south. So these are the south, west, east, northeast, and north. So these are the five regional organizations and which cover a group of states. And we have 22 state level organizations also, besides the each ROTO also acting as a state level organization, and NOTO is also a SOTO for Delhi and NCR region. So we have now 20, in a way, 22 plus 5 plus 1, 28 SOTOs which have been established to as part of this network. And they are networking with the hospitals, 838 hospitals, which could be transplant hospital, retrieval centers, or tissue banks also, which are part of this. So once a patient requires a deceased donor organ, then that patient is registered by the hospital, and every hospital which is linked with the national registry has a user ID and password. The staff of the hospital will register that patient, that this patient requires a deceased donor organ for transplant. Then after the registry, the name of the patient will reflect as part of the hospital list, as well as state list, as well as the regional list and national list. So once a donor becomes available from any donor hospital, the information goes to the concerned SOTO. Then SOTO has to check the waiting list and among the list of the patients, and as per the allocation criteria, the SOTO will allocate the organ to the concerned hospital or patient. And then if any organ is not being utilized in a state, then it has to go to the regional list, and then the ROTO decides. And if not utilized in the regional list, then the NOTO, it will come to the national level, and it will be the NOTO which will be deciding. If any organ which is donated is not taken by any Indian patient, then the organ can also be allocated to a person of Indian origin who is receiving treatment here in India, or to a foreigner if PIO is also not available. And these allocations are also done by the NOTO. Next, please. So we are also working on a uniform organ transport policy for basically providing a smooth transport of organs, particularly through the airport, and also other ministries. 7 ministries we have worked with the SOPs, and so that is the smooth out the process of the organ transport. As we can see that since there are disparities in the availability of facilities, so in the states where only retrieval facilities are can be established, from there the donated organ can be transported to the facilities where the transplants can be done. Next, please. Uh, towards we are working for one nation, one policy, in which we have now removed any patient which requires the state domicile condition has been removed, and any patient of any age who requires a organ, deceased donor organ, can go to any part of the country and register for receiving the organ, and there is no fee for registration. And a centralized registry of all these donors is to be maintained at the NOTO level with the real-time data collection from these. Next, please. NOTO has also basically to give a push to the organ donation, a Aadhaar linked pledge registration of the pledge for organ donation has also been initiated. And this is a little old data, but now we have crossed more than 138,000 pledges till now through the NOTO registry, which is the noto.abdm.gov.in. And registry can be accessed, this pledging registration site can be accessed even by scanning the QR code as displayed in this slide. Further, after you register, you get a e-donor card, the format of which is reflected on your in the right hand side of the slide. So this is basically Aadhaar linked authenticated registry, in which within around 4.5 months, now we have more than 138,000 people registered in this registry. Next, please. So Government of India is running a national organ transplant program. And today will be like, after this background, I'll be giving you what are the benefits being provided by under the program. So basically, program has certain objectives. One of the objective is the promotion of the health and prevention of the diseases which cause organ failure. Then promote, augment, basically to work towards augmentation of the deceased organ and tissue donation. Then augmenting the to augment the transplantation in the government sector, especially improvement of the infrastructure in the government hospitals. Then improving the transplant outcomes, basically to maintain the standards in transplantation and to ensure that we have a uniform and sustainable program all over the country, and to do the required training and coordinate with other agencies for carrying out the research which is required for organ transplantation. Next, please. So main role that the NOTO plays in all this is to prescribe various guidelines, protocols, and technical guidelines, to provide a web-based system of networking and maintain a national registry. And besides carrying out advocacy and awareness and dissemination of information through the website, we run a call center also, which is 24/7. The number is 1800114770. And we have our social media handles, which are quite active on Twitter, on Instagram, on Facebook, and YouTube. So all the four social media, the common social media are being used to promote organ donation as well as to disseminate various information. Noto also coordinates and organizes trainings and capacity building of the transplant related professionals, coordinate the organ transport at national level, particularly the transport where it is through the air transport, then consultancy on all aspects of the law as well as for donation and transplantation, then coordinate allocation of the organ outside the region and for person of Indian origin and foreigner. Noto also plays the role of SOTO for Delhi, where we are maintaining directly the waiting list. And Noto also coordinates the research along with other agencies. Next, please. These are the various financial grants that are available for the states or hospitals as applicable. Like for ROTO, for establishment of the ROTO, we have a non-recurring grant which is for refurbishment of the office for the NOTO, which is one time, and it is 68 lakh rupees one time grant for ROTO. Recurring grant is also given to ROTO for running of the office and payment of salaries and maintenance of the office. It is every year 1 crore 5 lakh rupees every year. ROTO has 11 staff and the salaries of those 11 staff is also given under this grant under the program. So entire component of the program under NOTP is funded 100% by the government of India. So it is 100% funding. It is a central sector scheme, a national organ transplant program. Under the similarly for the SOTO is the state level organ and tissue transplant organization. Basically, these ROTO, SOTO, and NOTO, they are equivalent of the organ procurement organizations that we see in other countries like USA and UK. So SOTO also recurring grant is given 48 lakh rupees per year, and non-recurring is given as 36 lakh rupees for setting up the office, which is one time. A recurring grant is every year. We also provide grant for developing a facility of retrieval center, particularly in trauma centers and in medical colleges. We say that every trauma center and medical college should set up a retrieval center, or that is the maybe retrieval center means it is a not having a transplant facility, but is having organ retrieval facility. So it is 75 lakh rupees a one-time grant, basically 75 lakh rupees for infrastructure and equipment. No manpower support is provided for these infrastructural grants. So it is for the infrastructure, like suppose you want to develop a OT, you want to develop a ICU, or you want to purchase certain equipment, you can carry out this grant. Then we have grant for transplant center. We have grant for setting up the transplant center, which is 1.5 crore, up to 1.5 crore. This is for, again, for infrastructure and equipment. And no grant is given for manpower for the transplant center also. So it is 1.5 crore one-time grant for setting up of the transplant center. So it is advised, like whenever you want to have, you identify the gaps and fill up the gaps with these, because I understand that with the 1.5 crore, you may not be able to have all that is required for a transplant center, but definitely you can fill up the gaps in a already functional multi-disciplinary hospital, particularly in government. And these grants, retrieval center, transplant centers, they are available only for the government institutions. Then upgradation of the existing retrieval or transplant unit. Suppose you have a retrieval facility, you want to add some transplant facility also, or you have kidney transplant, you want to add liver transplant, then upgradation is required, for which 75 lakh rupees can be given for infrastructure and equipment. For biomaterial center, tissue banks, so only for regional organization where the regional organizations are there, up to 1 crore rupees, again for infrastructure and equipment, it is given for setting up of the biomaterial center. Next, please. We also give grant for hiring of the transplant coordinators under the program. For government institution, which is a transplant center, we give grant for 2 transplant coordinators. For government trauma center, we give grant of 1 transplant coordinator. For private centers, which are also good performing private center or the retrieval hospital, at least where good number of retrievals are being done, under the program we support for provide support for hiring of 1 transplant coordinator, and the coordinator basically we pay for their salary, which is 35,000 per month, and also for their office expenses grants are given. So this is the way the under the program you can avail grants for hiring of the transplant coordinators. So like a medical college which is a transplant center and is also having trauma center, they can avail grant for hiring 3 transplant coordinators. Another grant that is available is for the BPL transplant recipients, the patients which are below poverty line and they have undergone transplants. And as you know, it is very important that they should receive their post-transplant immunosuppressant therapy or medications regularly, and under the program rupees 10,000 per month is given for for this component of the grant. Another grant is available to basically to give a mark of respect or as a token of respect to the deceased donor, rupees 10,000 per deceased donor person. It is given, and it is for dignified funeral of the deceased donor. And this grant, basically all these grants are given through the SOTO, state level organization, and these can be claimed through the SOTO, and SOTO is supposed to disburse this grant of dignified funeral of the donor, 10,000 rupees, and that is provided under the program. Another important grant that is available or support is available is for maintenance of the deceased donor. As you know, after the donor has been agreed, consent has been given, brain stem death has been certified, then donor has to be maintained in the ICU as well as in the OT till the retrieval is done. That maintenance is a huge expenditure on the hospital, and this expenditure can be borne by the state government, by the institution, by the recipient, or even by a non-governmental organization as per the law. But under the program, we also give a grant of rupees 1 lakh per donation for maintenance of the deceased donor. The rider, the condition is that one of the major organ, that is the kidney or liver or heart, should have been transplanted in a government institution. Out of the donated organs, if kidney or heart or liver is utilized in a government facility, then 1 lakh per donation for maintenance can be given even to the private hospital, to any retrieval facility which is even whether it is in government or in private. Usually we expect that the government, the expenditure on maintenance will be taken care by the government institution itself, but especially for private hospital, when they are one of the organ is donated and utilized in a government institution, then 1 lakh under the program can be claimed for towards the maintenance expenditure. Then we also give grant for creating awareness active to the SOTOs, as well as for conducting training and capacity building exercises, and that is given as per the proposals which are received from the state or the hospitals through the SOTO. Next, please. This is not under the program, but just wanted to inform that under the Rashtriya Arogya scheme, the Rashtriya Arogya Nidhi, which is a scheme to provide financial assistance to the poor patients which are below threshold poverty line, and they are suffering from the heart, kidney, or liver failure, and for their treatment in government or other identified institution, up to 15 lakh rupees can be given, and it is a one-time grant. The ceiling cost is up to the CGHS rate, and support is given for all the types of transplantation: kidney, liver, heart, lung, the common transplantation, and also support is given for post-transplant immunosuppressant therapy for 1 year. That is also included in the one-time grant. That is the maximum limit of the grant is 15 lakh rupees and 15,000 per month per into 12 months is included in the grant. Support is also given for dialysis facilities, which these kidney transplant patients would require pre and post transplant. Next, please. Then, as you may be, some of you may be aware that under the Pradhan Mantri Jan Arogya Yojana, which is a scheme under Ayushman Bharat Mission, the health benefit package 2.2, which has been now implemented. Which is this PMJY is a scheme which provides health insurance coverage up to 5 lakh rupees for one family, and under this coverage now kidney transplant or renal transplant is also covered, and this is the component wise breakup where you can see pre-procedure workup, donor, recipient immunosuppressives, transplant and induction for recipient with unrelated or diseased donor or at high risk for rejection. So these are the grants which are available for different categories. Then for 1A and 1B benefit type, this again the grants are available. Post-transplant medication, again the grants are available for first 3 months, 50,000, like this. Basically, for different categories of patients. You can look at further details under the health benefit package 2.2. But I just want to emphasize that grants are being given for kidney transplant under the Ayushman Bharat Mission, under the Pradhan Mantri Jan Arogya Yojana, and all those hospitals which are empaneled under this Yojana, they must offer this facility to their patients, poor patients who are, Ayushman beneficiary, who have the Ayushman card. This grant should be offered and utilized for these patients. Next, please. Basically, under the program, we are looking towards self-sufficiency in organ transplantation. Now, we talk about we can only achieve this if we increase the deceased organ donation and deceased organ donation transplantation. Further, we are also working towards improving the living donation, in which we want to increase swab donation. We also want to basically encourage donation from the living donors by honoring them, by recognizing their contribution. Then, as well as the deceased donor contribution, then we should give protection to the organ living donors. Government has recently, for the central government employees, has offered 42 days of leave, special casual leave to the patients, to the employees of the central government. Basically, we are looking also at the life insurance and disability care if needed for the living donors. Reimbursement of loss of pay, that is also needs to be ensured. Then standards loss of pay during the reasonable, which is reasonably attributed to the process of donation. Then we need to improve standards of transplantation and regular follow-up of our patients who undergo transplant, and their outcomes, they need to be part of the registry. And improve the infrastructure, training and capacity building, especially in the government sector, can help in achieving self-sufficiency in our country. Next, please. We are also looking at augmenting the infrastructure, where we are looking at having at least one government multi-organ transplant facility in every state, which could be a center for excellence for training others, then dedicated transplant units in the various departments where the transplants happen, and at least a one 24 by 7 immunology lab in each state, organ retrieval centers in the trauma centers and medical colleges. Then NOTO, under the ages of NOTO, we can have training and skilling centers. Organ retrieval can be part of the PG curriculum in general surgery, PG general surgery curriculum, mentor-mentee program, then transplant coordinator trainings, and there's accreditation or certification. So NOTO has already, standardized the curriculum of transplant coordinator training, uh, and which was released on the last Indian Organ Donation Day. Next, please. At the hospital level, we also advocate that all the potential recipients, they need to be offered organ transplant treatment and to be registered in the national registry, whether they are going for living donor transplant or for deceased donor organ transplant. Then still all the patients' data need to be in the part of the national registry. Nodal officer should be there in every hospital for organ donation and transplantation. The information of that should be given to the NOTO, and preferably the intensive care physicians can play the role of nodal officer. Hospitals are advised to carry out the audit of their brainstem deaths, as like particularly in the units, trauma units or neurosurgical units, where we get trauma or stroke patients. So these are the where there we can particularly get a number of brainstem death patients, potential, which are the potential donors, and they should be identified, and their declaration should be audited from time to time. Then every hospital should run a program to improve donation. Then we are also looking forward to issuing DCD guidelines and paired exchange guideline. Paired exchange is the swab donation. Then further improving awareness involving all departments of the government of India as well as states. Then NOTO has a mandate to maintain the registry through which we want to improve our organ donation surveillance with the cooperation of all the states and hospitals. We are also looking forward to tracking the foreigners' transplants which are happening in India, so as to avoid any kind of illegal activities related to foreigner organ transplantation. Basically, possibility of that should even be not there. Next, please. So thank you so much. As already told you, this is a 24 by 7 helpline that everyone should be aware for any kind of information or coordination that you require. And this is the address of the NOTO website, main website, noto.mohfw.gov.in. Helpline number, I am again repeating, 1800114770. So thank you so much. I am open to any question if you have. You can send an email also to me. So thank you so much, and all the best to ISOT for taking this initiative, and looking forward to many more such interaction with all of you in future. So thank you very much.
Over to you, Vivek, sir.
Uh, uh, Thank you, Dr. Anil Kumar, sir, for your valuable time from your busy schedule for the ISOT webinar. Saurabh, can you read out the questions from the chat box from
Yes, sir.
audience?
Yes, sir. Am I audible now, sir? Audible, sir? Sir, am I audible now?
Yes, audible, sir.
Saurabh,
Okay.
can you hear?
So,
Yeah, please
okay.
start.
So the first question is by Dr. Jitendra. He is asking how can organ transplant centers in smaller cities like ours improve accessibility for patients requiring transplantation?
Can you just repeat? Part of it is missed
Yes, sir.
actually.
Sir, the Dr. Jitendra is asking how can NATO support and facilitate establishment of organ transplant centers in smaller cities like ours to improve accessibility for patients requiring transplantation?
Basically, like now we have SOTO established in almost all the states which are active in transplantation. Uh, so it is there in 22 states, and we have 5 rotos, and noto is SOTO for, so 28 places now we have SOTO. So you can send your proposal through SOTO, and this will come to ministry level to us, basically in Noto or in the ministry level, and then we can give grant, as I've already mentioned during my presentation. Those grants can be availed; they are available, but the proposal has to be sent through the state government or the SOTO.
Sir, like, much for immunosuppression. Mentioned in your talk that NATO can help with 10,000 rupees.
10,000 rupees for immunosuppressant, 10,000 for funeral. Yes.
Yeah, Saurabh, your voice is less audible. I will carry on with the sir. There are few questions from the audience. Sir, in Pradhan Mantri Ayushman Bharat Yojana, sir,
Yes.
uh, there is a 5 lakh budget even for transplant. And for in 5 lakh rupees, it is difficult to do transplants for organs other than kidney, like heart transplant, lung transplant, or liver transplant. They will need like 15 lakh cost. So
Yes.
can we request Noto so that there should be any special category in Ayushman Bharat scheme so that transplant activity can increase, especially in the public sector hospital for other organs, because in 5 lakh kidney transplant is feasible, sir.
Yes, yes, you are right, sir. Basically, we have already discussed this with the National Health Authority, and we have requested them to raise the budget for so that the limit for other, so that the other transplants like liver and lung or heart can also be, availed under the Ayushman scheme. And we have also requested them to consider a support for organ transport also, which government patients are not able to afford. Like when the organ is to be transported from outside the state, then the cost is involved. So that we have already taken up with the NHA during various meetings we had hold with them. So that let us hope that they will consider it.
Thank you, sir. Sir, we appreciate the one nation, one policy for transplantation by the NOTO. And when we start the drone transport, probably it will be better if the transport vertical of the NOTO take care of all the transports. Because if the individual states they don't have the SOP for the transport, just for your input, sir, what is your suggestion, sir?
Yeah, we are going to hold a meeting with the member health, not the member health. There is one member in the Niti Aayog who is looks after the science and technology part. Basically, and ICMR has also constituted a committee on the drone transport. Basically, the concern from the transplant community side is this, that they want that the stability of the organ has to be ensured during the drone transport. So some research data they are trying to collect so as to ensure that before the scheme is drone transport is implemented, it should be ensured that they have conducted enough, they have enough data to ensure that the stability of the organ during the transport is not affected, and like the temperature etc which is there. And definitely it will be like under the aegis of the noto whenever it is going to be implemented. Like at present, the air transport, we have identified nodal officers in every airport to facilitate organ transport through the airport, like with the support of the Ministry of Civil Aviation. So that already is going on, and similarly, we would like to have a a government regulated organ transport through the drones also.
Thank you, sir. Sir, with the use of machine perfusion, we can sometime minimize the organ discard rate.
Yes.
So, is there any financial support for the machine perfusion, sir?
As till now it is not included in the program, but definitely it can be considered. I have also seen perhaps the it is the view from the, like we can have a it can be a ISOT can also write to us or to the government that because the army hospital is implemented this in their hospital, like every kidney they are transporting is through on a machine perfusion. So I think it should be considered if the outcomes are improved by if the if the machine perfusion is used during the transport. So and perhaps if the machine can be like if the consumables because I think the vendors are nowadays they install the machine without any capital cost, but if the consumables are being paid, so that can be, that should, if it is feasible, then it should definitely be considered to have the less rejection rate. Yeah, we need to have the good outcomes. That is also important. I agree with you that that can be considered if it is feasible within the reasonable cost.
Yes, sir. And sir, although India is number three for organ transplant, 85% are the living donor transplant. In our single center, sir, we have increased the donor pool with the swab transplants, sir. Total 535 swab transplants.
Mhm.
And despite the single center program, our experience shows that donor pool increased by 25%. So basically, when we do the swab transplant, this reduce the waiting list also on the cadaver, because almost 1.5 lakhs patients are on deceased donor waiting list. So recently, you initiated discussion on the One Nation, One Swab Transplant program. So what could be the way forward, sir, for One Nation, One Swab program?
Yeah, basically we need to issue guidelines from the government level, and we are already finalizing that because there were a lot of deliberations, and you had contributed to that deliberation, that one nation one swab program. So, and we need to issue guidelines from the government side so that some of the clarifications, like some of the provisions which are not there in clearly mentioned in the act and rules, so that they can be brought in and it can be facilitated at the national level. So we are working on that, and definitely once we come out with the deliberations draft, and we'll all the discussions that have happened during the recently held legal and ethical symposium, we are planning to take them forward for improving the deceased donor as well as the number of transplantation in the country.
Yes, sir. And sir, for example, in different states, the time needed for taking the legal permission for swab transplant is very variable. We get legal permission in 1 to 2 weeks, but the many other states they demand many documents which is not required as per the Transplant Human Organ Act. So ISOT requests NOTO to send one letter to all the states. What is a list of document required for swab transplant as per Transplant Human Organ Act, sir, because this is just a logistics issue. Just like for removing the domicile certificate requirement, you circulated one letter to all the states, and all states have accepted that letter, and now domicile certificate is not required for a registration of cadavers, sir.
Yeah, definitely we'll take it up and we'll issue with the approval of the our DG. This letter can be issued to the, because if there are unnecessary documentation which is not provided under the law or the rules, that should not be, like, that harassment should not happen. Yeah, for the patients basically.
Yes, sir. Thank you, sir. One more last question. There is question whether all government medical colleges can be given automatic status for non-transplant organ retrieval center. Sometimes lot of time is required for taking NTORC permission, whether this is possible in government medical colleges so that donation could increase. Or many time medical colleges are not familiar with the process of taking permission for NTORC, or how this process can be made easy, sir.
Basically, the all these medical colleges, they perhaps would require some budget for establishing a organ retrieval facility, and also initiative. They need to be having initiative to start this program. So that's why we are looking at that every person who is doing, every doctor who is doing PG in a general surgery should have organ retrieval mandatorily covered under his curriculum. And because these general surgeons would be there in almost all the medical colleges. And second, they can be given some support, financial support for starting organ retrieval facility. So we are hoping to take it forward in with the because now since the after few months elections would be there. So otherwise, perhaps our honorable minister had announced even in the Agra that organ retrieval facility will be set up in the medical colleges by the end of 2024. So during the Agra event, he had mentioned this, announced this. So we hope that once this election process is over, and we hope to take it forward aggressively, and we would seek budget from the government to provide the budget required for establishing these retrievals, so that they can meet the standards as laid down under the transplant rules. And then a automatic licensing from the state government can be requested, because without having the adequate infrastructure or ICU or OT, so that and the brainstem death certification facility, we so that we are hoping to take it forward, once this election process is over. And already it is on the agenda of the NOTO to, because I mentioned my presentation also, that we wish to have organ retrieval facility in every medical college, but definitely standard also is to be ensured. And we can request the, because right now the licensing is with the state appropriate authority. Then the state appropriate authority, we can hold meeting with the state appropriate authorities, and then they can with their after consulting with the state appropriate authority, then we can take it forward to have. And definitely once we hold the meeting, there would be demand for budget also. So we want to have that should not become a handicap for taking this initiative forward, because it is already on our agenda to establish organ retrieval facility in every medical college in a phase-wise manner.
Thank you, sir. There are many questions, but due to time limit, we will take these questions and email you. We appreciate your leadership for starting the disease donation activity in Assam and Manipur last year. And we also appreciate your initiative on One Nation, One Swab Transplant program. So with this, I will like to express our gratitude, and we have no words to thank you for your valuable time for the ISOT webinar, sir. Thank you, sir.
Thank you, sir. Thank you, sir. It's my pleasure to have joined today, sir. Thank you.
Thank you, sir. With this, we will close this session.